We continue with our bulletin, and health facilities across the country, especially in the Greater Accra region, have been struggling to save lives because there is no blood at critical times. That's according to the Ghana Health Service, which says health workers are heartbroken when they see patients who could have survived die due to blood shortage. Data for the 2020 maternal death causes indicated about 44% of maternal deaths were due to obstetric hemorrhage. This means about 5 out of every 10 maternal deaths could be prevented if there is sufficient blood at any given time. Now, beside pregnant women, accident victims who come in with a lot of blood loss with no relative to donate or mobilize blood become victims of all casualties for lack of blood. Now, the volatile condition that existed has been worsened by the COVID-19 pandemic, resulting in more preventable deaths than usual. The Health Promotion Unit of the Ghana Health Service, Greater Accra, is launching a campaign to address the problem of blood shortage. It is themed Love a Mother, Save Her Life, Donate a Pint of Blood Now. Joining us in studio for this discussion is Mrs. Eunice Joan Jagli. She's the Greater Accra Regional Health Promotion Manager at the Ghana Health Service. Ma'am, thanks for joining us. Tell us, how bad is the situation now?
As you just mentioned, blood is critical in life-saving, especially in our facilities. This has made it an international day being observed by the whole world. That tells you that blood is very essential, because with the blood, even those with life-threatening diseases can have a longer life and then be able to live a healthy life with their condition. And as it has happened from last year that we are struggling with the COVID, where gathering and then a normal life had become a thing of the past, those who usually come for blood donation voluntarily have also not been coming. And the programs we organize to mobilize the blood is also not in progress any longer. As a result, we barely getting a quarter of the blood we need to save life. And with this, as you just mentioned, we are losing a lot of people that should have been saved to enable them continue with life and be source of hope to others. So the situation actually is very bad in all our health facilities. And you and I can attest to the fact that we are even having a lot of accidents these days. And as you just mentioned, 5 out of every 10 deaths recorded maternally, that's maternal death, is as a result of loss of blood. So if we have sufficient, it means we can save 5 people from 10 before we try to do the other needed to be able to save the rest of the 5 that have other causes for dying from childbirth. In fact, we should all applaud when no woman die as a result of giving a new life. So if we are losing 5 women, some who even lose their children in addition, and some they deliver, the children are alive, mother is not alive to take care, you can imagine the effect of that on the child raising. And when it comes to other surgical procedures that need blood, you can imagine what is happening over there. If for maternal death alone, we are having 5 being lost out of 10,
right.
Then
right.
You can imagine the seriousness of the situation.
It seems quite serious. So if someone wants to donate blood, what do they do? What's the process that they pass through?
If you want to donate blood, you can walk to any health facility and tell them you want to donate blood, and they will take you through the process, do some medical check on you to find out your level of blood, your pressure, and the other checks, even some health conditions, to ensure that when you donate, you don't put your life at risk. So after those processes, if you are fit to donate, then you now be given the opportunity to donate, because we are very conscious of the fact that you didn't go trying to save a life and will lose your life either. So we want to ensure that everybody who donates blood is safe after the donation. And when we talk about blood donation, people think when you donate blood, you die. There are benefits of blood donation to the individual who is donating. In the first place, you knowing that you are saving a life is very important, and you feel happy you have saved a life. That one is emotionally satisfying. But we know that it helps reduce the store of iron in the body, which can also reduce the rate of a heart attack. And it helps you see how trees, when they overgrown, they are not able to bear fruit well again. The same way when you keep your blood in you for long, it doesn't give you the best of protection and the potential you need. So when you donate, it's like pruning a tree. It comes with a fresh blood, and then it gives you healthy life than it used to be. So with that, you yourself, you benefit from medical check that you didn't pay for. It helps you refresh and then renew your blood system. It reduces the storage of your iron level that can cause a heart attack. And besides that, you also save not only one life, because that individual who had the opportunity of taking your blood is a source of social, psychological, physical to so many other people. So you save so many other people besides the individual you've given the blood to. So that alone should be a joy and some motivation for us to ensure that we give blood to those who need it. And you know, in the world around, the world is trying to move away from paid blood donation to voluntary blood donation. It means, therefore, that if I don't have money to bring somebody to come and donate and I'll pay for, I'll lose my life. While somebody is walking around with excess blood that will not be of any benefit to the person, but can save my life. That is why the World Blood Donation Day had been instituted by World Health Organization.
So help me understand this. If I, maybe a family member is delivering a child and we bring in someone to donate blood, we have to pay?
No, please. If a family member or you are going for a surgery and you bring somebody to donate blood, you don't pay. But what happens is, if you are coming and you don't have anybody to donate the blood, there are people who have contracted themselves who are ready to donate, but they only donate with a fee that if you pay me this much, because I have to go back and take care of myself. So they use it as a business. So if you are in need and you don't have anybody to donate, then you have to look for those people to come and donate and you pay them. And sometimes what happens is, if it happens like that, they may not be able to get the particular blood because some of the blood groups are scarce. So if you're not able to get the particular blood, then you'll be stranded, and before you get it, maybe your person is gone. But when we have more people donating voluntarily and we have sufficient stock, it means we have all the categories of blood we need. So at any critical point, we'll be able to give out.
I understand. What I'm asking is because we do have some reports with evidence that some persons went to donate blood when their family members needed it, and they had to pay at the point of donation as much as 150 cedis.
For their own donation. Yeah. That one, I would say, is not in place. And, you know, the only thing for which sometimes the team is stranded, for which I don't know, I can't justify it, is because of the items they use for the blood bleeding. The sac, the chemical, the test, and so on. But that should not go as much as that. But there are some overhead costs in assessing the blood. They have to do some tests for you to find out whether the blood you are donating is worth giving to the person. They have to check your health condition. And you know, all these tests have some financial wait on them for you to be able to.
Aren't those finances taken care of by the Ghana Health Service or by the government?
Who would take care of it? If you are donating blood, who would take care of it? Nobody will take care of. Who would the cost be shifted to? But as to how much the total cost is, that is what I can't give you offhand.
Okay. Okay.
So that might be the reason why. And you know the sack has a chemical in it. That chemical is also a cost. But
when
you are coming to donate voluntarily, you are not paying anything because the system then absorbs it. You are doing it on your own voluntary, and we don't need to charge you for the cost to be able to get the blood available for others to use.
Right. Thank you, exactly. So that's the message there. You don't pay when you are donating blood, but you should go out and donate a pint today. Now, we are counting on your usual cooperation, and we're looking forward to seeing you at the hospital sometime. You're live on the Pulse here in Joy News with me, Daniel Daze.